Have any questions about physical pain, neck issues, knees, foot, she is here to answer as many questions as she can and give her insight. So please welcome Dr. Henricksen.
Thanks. Thank you. I'm so glad to be here with you guys. Is the volume okay? All right. If at any time I'm speaking too loud or anything or too fast, just let me know. Glad to talk with you guys today about how to use ergonomics and awareness of your body position in space to help minimize risk of on-the-job injury and help you have a nice long career. We'll get started with a couple of objectives for today. After talking with Stacy and talking with some of the my hairstylist and my massage therapist and people who have helped me over the years, after talking with them about some of the concerns that they had, developed a few ideas of things for this presentation for you guys today. What we will try to accomplish is to give you an understanding of some of the basic conditions affecting the foot and ankle, knee, hip, and low back, and identify some potential workplace and individual risk factors for those conditions, as well as some remedies or common solutions that you may be able to use to help yourself as you are progressing into your career, okay? And as we go along, please feel free to ask me any questions. Happy to answer them as we go through. A little bit about me. I've been a PT since 2001. I went to Texas Women's in Dallas, went to Texas Tech Health Science Center to do my advanced training. I've worked in a variety of settings, a little bit in outpatient, a little bit in inpatient, some acute care, and some orthopedics, work hardening. My specialty is in spine care. And then right now I am teaching for the University of St. Augustine, and I teach in the MSK track, the neuro track, and then the evidence-informed practice. We were having a great discussion about creating a research study over essential oils and their effects on the body after discussing some of the things that you guys have been learning. So that was fun. So common conditions of the back and the lower body. So we're going to start talking about our neck a little bit and our back, the hip, knee, and the foot and ankle. We'll start from the bottom and work our way up. Couple of common conditions that I thought might be applicable to you guys. And if there are some other things that you are having yourself, please feel free to bring them up and ask questions about them. But we're going to talk about plantar fasciitis. We're going to talk about bunions and hammer toes, posterior tibialis tendinopathy and the fallen arches that can be a result of that condition, and then just general swelling and edema that can happen when we're on our feet all day. So here's our summary slide, just kind of a high-level overview of these conditions. So for plantar fasciitis, starting there on the left, this is a condition where we have pain and inflammation on the bottom of the foot in what's called the plantar fascia. That's a strip of tissue that goes from the heel bone to the base of the toes and is part of the support system for your foot. So sometimes this fascia can get irritated. Sometimes the symptom you might notice at first would be when you get out of bed first thing in the morning and you put your feet on the ground, there's pain at the heel or the arch of the foot. Anybody had something like that before? I know I have. From the perspective of physical therapy, when we look at someone who has symptoms in the arch of their foot, we want to know kind of what their foot mobility is like, what their footwear is like, what kind of shoes they're wearing, if they have cushioned, if they have arch support, if they're on their feet all day. We also look at their calf muscles, whether their calf muscles are tight or stiff. And we may look also at the strength of the rest of their leg and how they're standing. Some things that predispose someone to having plantar fasciitis might be standing on a hard floor all day, which it looks like this floor is pretty hard. Might also be having flat feet to start out with. Has anyone ever stepped in like a puddle outside on your bare feet, and then you put your foot outside the puddle and you leave a footprint on the ground? Do you have a nice foot shape, or is your foot shape kind of all flat? Do you know what I mean when I say a foot shape? You know how sometimes they'll have the little baby feet and it has a nice little curve to the baby foot and little toes. Does your footprint look like that? Or does it look more like the whole foot is on the ground, including the inside of the arch? So for some people, when they have a flat foot, it'll look like the inside of the arch is on the ground too. But having flat feet, or even the opposite problem of having a high arch, like a stiff not as flexible arch could also predispose someone to having a plantar fasciitis condition. Wearing shoes that are not supportive, standing for a long period of time, or shoes that don't have enough cushion could also be a concern. If we look at the bunions or hammer toes, is everyone aware of what a bunion is? Where the big toe is kind of leaning in towards the second toe, and so we have a little bony overgrowth on the inside of the foot there. The bunion can cause pain and swelling. There can be stiffness in the big toe, and it is often caused by having shoes that are too tight or narrow in the toe box. And I'm kind of looking at everybody's shoes, and I love seeing that we have shoes that are not tight and narrow in the toe box on our feet right now. It can also be caused by wearing high heels for an extended period of time, because we're putting all of that weight through the toes of the foot as opposed to spreading the weight out through the whole foot when we're wearing the high heel. And then sometimes people can have an inherited foot structure that predisposes them to having a bunion develop. Now, the nice thing about bunions is if we catch them early enough, we can often stretch the soft tissue. We can often strengthen some of the intrinsic foot muscles to help decrease the progression of that bunion. But that does typically require a bit of an assessment from someone who's knowledgeable about how to correct these things and a specific plan for that individual for their bunion. Now, Stacy mentioned that you guys were having a podiatrist come talk at some point. They've already come, right? Great. What kinds of things did your podiatrist have to talk about? Some of these? They're kind of common conditions, right? So I would love to know if there's other things that you found helpful about what the presentation was this morning. Were you guys all here for that too? Is everybody right? Okay. All right. Well, very good. Anything else to add for the group as a whole from what you heard this morning? Okay. Types of shoes that are good to wear, not good to wear. Fantastic. Yeah, so thinking about how the shoes are constructed and what's a good quality shoe. Well, fantastic. I will not repeat exactly what they said then. Lovely. So another piece of kind of the bunion and the hammer toe is the hammer toe. Did she talk very much about hammer toes? No, not really. So I'm not sure how well the picture shows up, but this very bottom picture right here, we have the toe that allows both of the main joints to be straight, and then we have the toe that has a bend in that second joint. And so it ends up with a bend, and then the first one is straight, right? So it kind of forms like a little hammer. And so this can be caused by wearing shoes that are too tight. And it can be caused from an injury to the tendons in the bottom and the top of the foot that we often can't really correct hammer toes, but we can change the way our footwear is supporting our feet so that they don't continue to progress. And then if you do not have hammer toes, wearing shoes that are supportive and have a wide enough toe box and not standing on your toes, like not wearing high heels for most of the day, can be helpful in preventing that. Moving to the next little section is the posterior tibialis tendinopathy. And so if everybody kind of crosses your leg, where your ankle's on your foot, and then slide your hand down the inside of your foot, down around the ankle bone. And if you're on the ankle bone, I'm gonna hold on for balance here because I can't talk and feel my ankle bone. Go around the ankle bone, just around the bottom side of that ankle bone between your ankle and your heel. That's the path that your posterior tibialis tendon takes. It comes off the back of your shin bone, goes down around the ankle bone, and then it attaches on the bottom of the foot, underneath, supporting the arch. Okay, so this is part of the muscular system that supports the arch of your foot. And for some of us, if we have feet that are already tending to try to pronate or get more flat, pronate's a fancy word for that, that tendon can have essentially kind of a repetitive use injury as our feet are pronating and being in that position. And so for some individuals, especially when we get kind of in our middle age years, like our 40s, our 50s, we can be more prone to having some tendinopathy caused from repetitive use or footwear that's not supportive, maintaining our arches. And when we get that tendinopathy, it can cause us to develop more of that flat foot, because that's part of what supports the arch in our foot. So I'm glad that you guys have heard lots of things about supportive shoes, because that will help avoid some of these conditions. And then the last one, swelling and edema. Anybody who's been on their feet all day and had a little bit of swelling around their ankles when they go home at night? A little bit, some people are saying no, some people are saying yes. So when you're on your feet all day, when you think about our circulatory system, we have arteries that take blood out into our limbs and veins that bring the blood back, okay? And so the veins, they have a valve in them that only goes one direction, back towards the heart. So when blood goes from my foot to my knee, in the vein, it's only gonna go from my foot to my knee. It's not gonna go back from my knee to my foot, as long as those valves are working properly. So part of what helps push the blood up through the veins, through those valves, is the contraction of my muscles. So if I'm just standing stationary all day, my muscles are kind of working, but they're not working a lot, right? They're just kind of holding me in place. As opposed to if I'm walking, my muscles are contracting. Every time my muscle contracts, it helps to squeeze the veins, which then pushes blood back towards my heart in that one-way valve system. So if I've been standing, for me, if I'm standing and I'm teaching all day and not moving around and walking, I might have a tendency to have some swelling in my feet when I get home at night. Or if I've been stationary all day, like sitting, if I've been sitting for a long time. You guys heard kind of on an airplane, you should do some ankle pumps if you're going to be sitting there for a while, like bringing your toes up and down, raising your heels up and down. It's kind of along the same mind frame, okay? So some of the things that can predispose us to swelling, we could be standing all day or sitting all day in one position, being overweight, pregnant, being older. Some medications can make us have a little more swelling than others. We could also have hormonal changes at times that can influence our water retention. And then sometimes if we have problems in the veins, have you guys heard of varicose veins? Where essentially the blood is pooling in the vein because the valve is not working as it should. That can also cause us to have more swelling. So we'll talk in a couple of slides about some things we can do individually to help us manage these kinds of things, like wearing compression hose or stockings and that sort of thing. You can get them in all different kinds, right? I wear mine all the time because I'm on my feet a lot or I sit a lot. All right. So any questions about those couple of conditions? Yes. What'd you say?
So what's something we can do to catch varicose veins to try to do something about it before they get bad and start like,
Sure. So the question is, what can you do about varicose veins to catch them before they get bad? And so one of the things to kind of be mindful of, varicose veins tend to kind of start at places where we have compression, right? Because that is going to affect the flow of the blood back through the vein, which then causes pooling, which puts strain on that valve that's the one-way valve. And it's a great example, if you can peek over here, little varicose vein on the inside of the thigh, or inside of the shin.
I'll show everybody.
Thank you for being my model.
Right here.
So for varicose veins, there is sometimes a genetic predisposition to having them. Another thing that can be contributing is a previous injury, right? Where we have some, like if you get a significant bruise and have some bleeding under the skin, that could be a predisposing factor. Crossing our legs for an extended period of time also causes compression where those legs are crossed, and everybody just kind of switched their legs around, right? It's all good. It's also good for your back to not sit the same position all the time, right? Just shift, right? Our bodies were really made to move rather than just be stationary. That's a great question. Did that give you some ideas? Okay, fantastic. Okay, so we'll move up the body a little bit, hip and knee. A couple of things that I thought might be helpful to talk about here would be patellofemoral pain syndrome, which is basically kind of pain around your kneecap area, osteoarthritis of the hip or the knee, And then greater trochanteric pain syndrome, which is really just kind of pain on the lateral side of your hip, but we'll talk a little bit more about each of those. So patellofemoral pain syndrome, basically we talk about pain around the front of the kneecap. Anyone had pain in their kneecap before? You have been diagnosed with that before, okay? So maybe you can lived experience. The pain is worse when you're doing things that require bending, okay? Okay, so sounds like when you were in high school, maybe cheer, talking about growth plates closing, middle school, your whole life. So cheer, the repetitive jumping, landing, loading, the stunts that you would do, repetitive bending motion is what caused it. And it sounds like it's gotten better, but not all the way. The greater trochanteric pain syndrome, yeah, the lateral hip pain, that too. Okay, well, hopefully we'll have a couple of things that can help you out a little bit later. With that patellofemoral pain syndrome, and this may or may not have been your experience, but you could have grinding or clicking with bending or straightening as the kneecap is moving on the femur. And a lot of times when someone has this condition, the repetitive motions can be an issue. Also kneeling for a prolonged time can be another issue. So as you are finding positions of comfort to perform service, like if kneeling at a foot basin, or you guys have regular chairs for when you're providing your esthetician services and they're laid back in the, or stools maybe, when they're laying back in their, you guys are describing kind of the chair that lays back that your clients are on, or the little tables, and you guys sit at their head, and you have a stool or a chair of some kind, traditional stool, okay? Something to avoid putting pressure through the front of the knees. Like they have kneeling chairs that are available that keep the pressure off the front, but keep the pressure on the shin. So those could be some alternatives to just straight kneeling on the knee. Sometimes people will have weak thigh muscles that's contributing to the abnormal loading of their kneecap, causing this condition. Sometimes they'll have some weak hip muscles that contribute as well. There may have been trauma, overuse as you were explaining in your cheer experience, and then possibly some issues with alignment of their kneecap. Knee or hip osteoarthritis. So this can present as pain in the hip, the thigh, the buttock, or the groin, or possibly the knee. And ironically, the hip osteoarthritis can refer pain to your knee, and your knee osteoarthritis could refer pain to your hip. So if you're having hip or knee conditions, rather than kind of popping on a social media or Instagram page or kind of looking, Dr. Googling your hip or knee pain, it's worthwhile to have that assessed by, my preference would be a PT, but that's what I am. We specialize in orthopedic issues, but having that at least looked at by your physician at a well check to rule out any other potential causes for that hip or knee pain. For osteoarthritis, you might see catching or clicking in the joint as you're moving. And this patellofemoral pain syndrome at times can also kind of predispose someone to developing osteoarthritis of the kneecap on the thigh bone. But osteoarthritis can have pain or stiffness or swelling, and the way osteoarthritis kind of comes about is on the ends of your bone, where your bone is kind of touching other bone, you have something called cartilage. And that cartilage provides a little bit of a cushion between those bones. And with arthritis, that cushion becomes thinned and sometimes can be a little bit worn down, and that's what starts the whole process of pain and inflammation, okay? One of the best strategies for managing osteoarthritis is to stay mobile and keep your muscles that surround those joints strong and functioning well. For greater trochanteric pain syndrome, has anyone kind of laid down on their side and had like pain on their hip where they're laying? Like if you lay on the floor to do yoga or anything and you kind of lay right on that bony place out there and it gets a little bit sore? No? Like on your hip bone, where you lay on your side and your hip bone's kind of pressing into the floor and maybe it feels a little bit stiffer. So I'm seeing a couple of people shake their head yes. So this area, this greater trochanteric area, it's basically a part of your thigh bone, and it's a site of place, it's where you have a lot of muscles that attach, muscles from your gluteal muscles attach here on the side of your hip. And anywhere a muscle is attaching to a bone, we have a bursa, which is a fluid-filled sac that provides some cushion for that interface between the tendon and the bone, so it doesn't rub, okay? And so when we have greater trochanteric pain syndrome, we could have an injury to the muscle or the tendon that could be like a tendinopathy that's causing that pain in this area. It could also be where the bursa is compressed or irritated or inflamed that's causing pain in that area. There's a couple of different things. So lateral hip pain could be another something to have checked out by a PT or by your physician if that's coming about for you. This pain could be a sharp pain or an ache. And a lot of times we find that when we have this lateral hip pain, we also have some weak hip muscles that go along with it. That can be the benefit of coming to see a PT. Not that I'm trying to push PT on you, that's just what I know the best. But one of the things a physical therapist does is constructs a custom individual plan to address the impairments that you yourself have, rather than just kind of a generic stretching routine. A little bit later today, I have a stretching break kind of group of things that you could be doing, but they're not specific, right? It's just kind of a general thing. When you go see a physical therapist, you have a specific plan that's tailored just for you, should you need it. Any questions about hip and knee kinds of things? Any other types of condition or pain that you guys are familiar with or have been diagnosed with that you'd like to talk about? Yes.
I used to do cheer as well, and then it's in my wrist, it's mid-carpal instability.
Okay.
And I just had pain ever since, I got diagnosed with it. I was 11 and I'm 21 now.
Okay, so some wrist pain with some mid-carpal instability. And you were diagnosed. Did you have any intervention or any therapy or activities to help you with that?
Physical therapy for a little bit.
Uh-huh.
But then they stopped me after like a few months. But I still have really bad pain here. So
Okay. Okay, so obviously I haven't conducted a full evaluation of your wrist, but many times, this is kind of one of those general things, right? If you were coming into the clinic to be evaluated by me, we would look at your range of motion, your strength, what motions in particular caused you pain. We would look at your stability within those joints, as well as your grip strength, and then up your arm as well. Because a lot of times what we find is when we're having wrist instability, we also have some muscle tightness or weakness up in our proximal muscles. It's causing us to use our wrist in different ways to get in positions when really we could adjust at our shoulder. So if you came into the clinic, we would look at kind of all those pieces and develop a plan that would help address the instability, probably starting with some isometric, which is where you're firing the muscle but not really moving the joint. Maybe you had some therapy where they had you hold in place and resist the bending. And then you probably had some grip strength because the muscles that are involved in your grip cross your wrist and go up and attach at your elbow and just above your elbow. And so these help provide some secondary stability for your wrist joint itself. So yeah, sure. Thanks for asking. All right. So back and neck conditions. Anybody back or neck pain? Okay, so if you're not raising your hand, that's awesome. Actually, back and neck pain are some of the most prevalent injuries that we have in our country, in the United States. They're also one of the most expensive injuries that we have because of the time, not only in like healthcare related things, but also the lost time from work. When we think about back and neck common conditions, there's kind of a lot of variety there. So we're going to keep it kind of brief right now and talk about low back or neck pain. It can involve the bones themselves, those are called your vertebra. It can involve the disc, which is kind of the cushion between the vertebra. It can also involve the muscles in the back. Anybody have trigger points? Where if you push on a place in your muscle, you can feel the pain right there and it kind of spreads out a little bit. right? You were talking about the elbow to the back earlier. A lot of times people will take kind of that bony prominence of their elbow and they'll sink it right into a trigger point and kind of hold it or kind of rub it a little bit to try to get that muscle to relax. So back or neck pain could be caused by muscle injury. And then finally, we could also have nerve-related pain. So nerve-related pain will often end up where people will have kind of numbness or tingling in their limb, and that's really coming potentially from an area in their neck. They might also have actual weakness as a part of that nerve-related condition, and they could have decreased sensation that goes along with that numbness and tingling, okay? Hopefully, no one who raised their hand for back or neck pain has those symptoms right now, but that could be some of the things that might be part of a back or a neck injury. And when we're thinking about trying to limit or prevent back and neck injuries, what kinds of things do you think would help us with that? So maybe thinking about the mattress that we're sleeping on, okay? Yeah. What else do you guys think? I'm sorry? A back brace? So like using a back brace to kind of be more aware of where we are in space. Okay. So that could be something, are we talking about using a back brace when we've had an injury? Or a back brace when we haven't had an injury, but we're just trying to be more aware? It could kind of be either, right? Sometimes, have you ever seen someone who's working in a warehouse and they have the brace around their back and it's to kind of, it's a brace, but it's really to help them realize when they start to bend. The brace gets in the way. It's like a physical trigger that makes them straighten up and bend from their hips rather than in their back, right? So that could be one use for a back brace. Sometimes people will have a back brace after they've had an injury to help them remember to restrict their motion or to provide a little bit of support. So one of the things we can do to help ourselves with risk of injury from to our back or our neck is thinking about how we're moving our spine, how we're positioning our spine. If when we need to bend, if we do what's called a hip hinge, okay, so maybe everyone stand up because you're looking too comfortable. Let's stand up. Okay, so what I'd like you to do is kind of get your feet about shoulder width apart. Draw your belly button in, kind of like you're sucking in to fasten a tight pair of pants, but your pants are only one size too tight, not 5, right? So just a little draw in, okay? And then you're gonna go from your hips, you're gonna bend from your hips. So your bottom goes back a little bit, you're keeping your back straight, okay? And you're gonna come back up. And you guys did a lovely back bend. So now this time when we do it, what I'd like you to do, instead of looking at me while you bend, I want you to kind of get your gaze in front of you on the floor so you also keep your head and your neck in more of a neutral alignment as opposed to chin up. Okay, so kind of keep your gaze towards the floor so your whole spine is staying in a nice neutral alignment. All right? So that feels a lot different than this, right? As you are moving about your spaces, if you need to reach into a drawer or a cabinet, we want to think about keeping that nice neutral spine position. If you guys would like to sit down, you may. If you want to keep stretching and standing, you can. Reaching into a drawer, maybe I stagger my feet a little bit so I can hip hinge a little further, keeping my face neutral to open that drawer, as opposed to bending to open the drawer, okay? If I need to pick something up off the ground, and I have a slide on ergonomics, we're just kind of jumping through, we're starting early. So something on the ground, those same things that we just talked about with the hip hinge. Sorry, I'm gonna hinge my hips towards you. The hip hinge and keeping the spine and the neck neutral, I wanna get my feet on either side of the object that I'm picking up, straddle it a little bit, gonna bend my knees and my hips, so I'm keeping my spine straight to pick up that object and rise back up. Okay, that's as opposed to, and I'm not gonna pick it up this way because I like my back healthy, bending over to pick it up like this. You can see the curve in my spine. Okay, sound reasonable? Okay, perfect. I don't want to jump too far ahead. We're going to come back and talk about backpacks too, because who carries a backpack to work or class? Everybody, backpack to class? Yes? Okay, we're going to talk about how to do that efficiently and safely for our spines. But before we get to talking about backpacks, let's talk a little bit about some of these things we can do for the lower leg, okay? And the podiatrist that was here already spent time talking about shoes, the construction of shoes. Is it not working anymore? Oh, I don't know. You guys can't hear me? Is that better? No? Here? This one? Talk louder? I can get louder. You still can't hear?
Come closer. Let's make this a private affair. Come closer. I want you to stare into her eyes. And
You all like each other, right? Like it's okay, we're all friends. I took a shower. Did everybody else? Nobody stinks. Maybe the way the echo is. Is that better? Is that any better? There's like this whole open space. Okay, well, if I need to change something, I'll do my best to figure out how to do that for us. So the podiatrist that was here already spoke with you about shoe construction, right, and what to look for. Talk a little bit about maybe orthotics. You can buy some off the shelf. You can also get specialized orthotics depending on the need for your foot. When you're choosing your shoes, hopefully they talked a little bit about having good arch support, having a wider toe box as opposed to a narrow toe box, and then having an appropriate amount of cushion. Some other things that you can do would be the compression socks or hosiery. I just pulled a picture off Amazon. They come in all shapes and sizes. You can get compression that is as little as 8 to 12 millimeters of mercury. You can get 20 to 30. Any higher than that, and you're probably starting to get more towards the medical grade of compression. Personally, I use the 20 to 30 for standing most of the day. That's also the same kind of level of compression you'll find in a lot of the athletic compression socks. So they're pretty easy to find if that's something that you are interested. That can help with managing edema over the day. When you're standing, how many people stand like this? So as best you can, try to be standing on both feet evenly. When you're standing, you want to be able to feel your big toe on the floor, your pinky toe on the floor, and your heel. Essentially kind of making a tripod to create that stability with your foot. Now that doesn't mean that we only do this, right? Because if you're trying to shift around and adjust to be around someone in a chair or another area where you're providing services to them, you may have to kind of shift your weight, right? But we just don't want to hang out on one side. Because this position, so tell me what you think happens. So here my pelvis is level, right? If my pelvis is level, that means my spine has a nice straight shape to it, yes? Means my neck is my head is nicely balanced on my neck. Okay, so imagine what happens if I stand on one hip. What just happened to my spine? I had a curve, right? And you know, my brain wants my eyes to be able to see straight ahead. So if I shift in my low back, that means I shift in my thoracic spine, that's around your rib cage, and that means I also have to shift in my neck to get my head upright. So I just kind of did this little wiggle with my spine. How's that gonna feel at the end of the day if I'm like this all day? Probably gonna have some tight muscles, some sore muscles, and be uncomfortable. So when you're standing, try to have that weight evenly on both feet, shifting periodically throughout the day. And then anti-fatigue mats. Who has I don't see any out here, but that doesn't necessarily mean that you guys don't use them because maybe you cleaned up this area. So an anti-fatigue mat, that is a mat that has some closed cell foam that would go underneath your feet while you're standing in an area where you're providing The examples I have are mostly around the hairstylist station, but you can imagine how that would apply anywhere you're standing on your feet. A lot of people will have them in their homes, they'll have them in front of their kitchen sink, right? That could be another option. All right, so we kind of talked about this a little bit already because you looked at my posture when I cocked my hip out to the side. But if you look at these images up here and think about the way you see yourself standing, which one do you think you are? Are you someone who kind of stands with your ear right over your shoulder and your shoulder right over your hips and your hips right over your ankle bones? Are you that blue? I think it's blue. The first blue picture? Or are you someone who kind of stands a little bit like this, right? They're kind of slumped. That's kind of the orange next to the blue. I guess that's orange. Or this person who's yellow, they kind of are standing like this. Someone who is the slighter orange one where they're more slumped this way. And then you have the military upright people who are like very straight. That's not very ergonomic either, right? Because now your muscles are working too hard to hold you up straight. And then finally you have the person who's very rounded and leaning back and kind of slumped this. I can't even do it, I'm going to fall over. But people have all different postures. And so as best we can, we want to assume a more neutral posture. So let's all stand up one more time. I really don't like people to sit a lot, so feel free to stand, and then let's get our weight evenly on our feet. You're going to kind of keep your shoulders back and relaxed. Draw in your abdominal muscles just a little bit, so just one level of skinny jeans. And then you're going to balance your weight evenly on both feet. Can you push your big toe into the floor and your pinky toe into the floor and kind of settle on your heel a little bit? You feel that triangle underneath each foot, kind of grounded into the floor. Okay, and then go ahead and shrug your shoulders up, turn your palms forward, and then put your shoulders down in the back. Keep your shoulder blades right there and just let your hands come by your side. So now you've essentially straightened up your posture, let your hands by your side, without having to like arch your back, right? We just kind of used our shoulder blades to get ourselves more upright. Just kind of do a self-check. Does your ear feel like it's right over the point of your shoulder? And does your shoulder feel like it's right over kind of the bony part of your hip? And then your bony part of your hip feels like it's right over that outside bone of your ankle. So now you kind of have yourself all aligned in a neutral posture. Who thinks this feels kind of awkward? Because we're used to being like this, right? So as you practice, you can go ahead and have a seat if you'd like, but as you practice kind of assuming these positions, they're going to start to feel more natural because you'll retrain your body to be comfortable in this position. And it's worth the time and effort because it helps decrease the wear and tear from altered postures that can cause pain and discomfort. All right. So I'm not calling anybody out, but let's think about what we do with our devices. So I have teenage boys, they're 16 and 19, and you can tell they're the children of a PT because this is what you hear at my house a lot. Bring your phone up to your face. Or sit up tall in your chair. Or if they're working on, so they have Chromebooks, right? The 16-year-old has a Chromebook because he's in school and that's what they use. And it's always, the screen is always down too low. He's also 6'3", right? So he's pretty tall. He's kind of like this person in the picture here on the left, where the screen is down low. He's essentially kind of slumped forward. He's looking at his phone in the picture, but you can see how his line of sight's also where it would be with the monitor, right? Look over just a little bit to the right and you see kind of the skeleton rendition of what's happening when he's looking down at his phone. You see the angulation of that red line? That means that all of the kind of weight and pull from his head and neck is right there at the junction of the neck and the shoulders. Has anyone observed someone who has a little bit of a hump to their upper back? So over time, if we continue to have a forward head posture, we can develop more and more of that hump. A little bit of curve is normal, right? But a lot of curve is not. And if we develop an excessive curve, that can affect our ability to move our neck in space, okay? Our posture, our sitting posture, can also affect the way we move our arms and shoulders. And I'll show you that in just a second. I don't want to forget to talk about the weight of the head, because to me, that's just amazing to think about. Your head weighs between 8 and 10 pounds. What all do you know weighs 8 and 10 pounds? A bowling ball, yep. A baby might. A gallon of milk, it's about 8 to 10 pounds. So imagine if your wrist is sore, hauling around a bowling ball or a gallon of milk. You want to kind of keep that really neutral or not carry it at all, right? So when we think about our head being on our neck, we want to keep that 8 to 10 pound weight of our head kind of centered on our neck, right? So that we are keeping the line of force of the head and neck right down through the spine to make it more efficient for the muscles. If we, you know how we talked about the ear being right over the shoulder when we were standing up just a minute ago? If my ear comes just 1 inch in front of my shoulder, that effectively makes my head weigh 20 pounds on my neck. Okay, if my ear comes 2 inches in front of my shoulder, okay, so everybody kind of stick your head forward and feel what that feels like. It feels a lot different on your neck, right? It essentially, 2 inches in front makes your head feel as though it weighs 30 pounds on your neck, as compared to when my head's right over my neck and shoulders. So when you're thinking about the position that you put yourself in while you're doing your daily work, try to think about that alignment of having your head balanced over your shoulders. If we look at this picture, I know it's a hairstylist picture. If I'd known it was more estheticians, I could have brought different pictures, so I apologize for that. But look at this picture, and what do you notice about the stylist who is working? Their head's forward, right? They're kind of this. What else do you see? Kind of cocked to the side, right? So if you were to take what you know so far, what would you tell this person to help them improve their position? What can we do? I love it. Could raise the chair. Oh, dang it, they didn't buy the expensive chair. What else could they do? They could put something in the chair to have the client be up higher. Great. Good. What else could they do? Maybe stand on a stool, elevate their own surface some. The client stand on a stool? Maybe the client stand on a stool. Maybe they could sit to bring their eye level down, right? So that they're not leaning over, and like the stylist could sit. I know the person who has cut my hair for like 12 years, I think, I love her. She's had her children while she's been cutting my hair. We're really good friends as well. But she has one of the tripod stools, where when it's time for her to cut kind of the lower part of a hairline, or when she cuts my straight cut across the back, she sits down. So she's not trying to do this, right? Because the chair doesn't get up any higher because she's pretty tall, right? So she has to sit. So that's always an option. All right, so let's do one more experiment. So everyone kind of just sit with your posture, just sit how you're sitting, and just raise your arm up as high as you can. Just one arm, okay? Now what I'd like you to do is sit up tall in your back. Don't move your arm, just sit up tall in your back, and then see how much further you can get your arm back. Could you go a little further when you changed your head and neck position? It looked like some of you could. Okay, go ahead and you can put your arm down. So the reason I point that out is because your arm is connected to your torso through your shoulder blade. And you guys have talked a little bit about upper extremity conditions in November. Okay. Okay, all right. Well, then we'll talk about that just a little bit. Your arm is connected to your shoulder blade, right? And your shoulder blade is connected by muscles, primarily to your back, and then one bony place to your clavicle, which is your collarbone, which then is connected to your chest. So most of the stability and placement of your arm in space comes from the muscular control of your shoulder blade. Your shoulder blade rests on your rib cage, your thorax. So if my rib cage is kind of flexed forward because I have this forward head posture because I'm not paying attention to the way I'm standing. And I go to lift my arm, I can't get it up very high. If I'm lifting my arm here and kind of repetitively pushing my arm into that end of range of motion, I could essentially give myself an impingement problem, a shoulder impingement, where I'm causing compression for the tendons and the bursa in my shoulder. If I do only one thing, I go from this flexed forward head posture to straightening up my torso. I go from being able to lift my arm here, that's as high as I can reach into the cabinet to get whatever it is I need. If I just straighten up my upper back, now I can reach higher. I did nothing else to my shoulder besides correct the alignment of my spine. So as you're thinking about how you're reaching for things as you are reaching up and in, think about where your body is in space and try to keep your upper back in more of a neutral position to have full range of motion of your shoulder. All right, so we started talking a little bit about ergonomics and back body mechanics. Kind of already demonstrated this picture of the gentleman who's bending over. We're not going to do that. We're going to squat to pick something up. Let's talk a little bit about backpacks. When you're carrying your backpack, who brings it in on one shoulder? Or you have just a big purse, a big bag, okay? Who carries it on two shoulders? Okay, a couple of people. All right, so let's see. So my backpack right now, it's got a bunch of stuff, charger, computer, and then it's got my planner and some of my supplies. So if I put my backpack on one shoulder, what just kind of happens to that shoulder to keep it there? I elevate my shoulder. So now these muscles on this side have to fire a little bit more to keep that shoulder up. What else happened? One shoulder's higher than the other. What does that mean for my spine? I twisted it, I curved it a little bit, right? And if I've curved my spine a little bit in the thoracic, what happened to my cervical spine? I had to straighten myself up, yes? Otherwise, I'd be walking around like this all day. Okay, so when you're carrying your backpack, as best you can, try to go for 2 straps. Okay, 2 straps so that you get the weight centered on your spine and you're more in a neutral alignment. Okay? The other piece about the backpack is kind of where it's positioned on your back. What do you notice about my backpack here? Where is it positioned? Maybe in the small of my back, right? It's just above my pelvis. Okay, I want my backpack to be in this area so that my abdominal muscles have more of a mechanical advantage to turn on to help support my back. If my backpack is really low, and I'm not going to be able to adjust it because I don't usually wear it adjusted, but if it's really low and it's hanging down here, you can imagine how that would pull me this way, right? How's that going to feel on my back over time? Especially if it's a really heavy load. That's going to cause a lot of compression in my vertebra and irritation to my nerves and my discs. So small of your back, both shoulders is what I would recommend for your backpack. All right, let's talk about pulling carts and things. Who pulls a cart or pulls a bag on wheels? Anybody? I'm sorry? You do? Okay. When you think about the cart that you're pulling or the bag on wheels, let's think about a couple of things. First of all, kind of the height of the handle. Okay, I didn't bring a wheeled cart with me, but for the handle height, I need it to be about that bony place on my hip, right? So that when I grab onto it, I'm not leaning over to reach that handle. It needs to be about my hip height. The other piece about using a cart is where my arm is when I'm pulling. I'd like my arm to stay in line with my body so I can pull. I can pull with my hand pronated, or I can flip it around and pull with my hand facing forward. So I could have my hand this way or this way. If my arm is in line with my body, that helps protect my shoulder. If my arm's way back here, that can put a lot of strain on the front of my shoulder, increasing my risk of injury. The other picture here is just talking about general pushing and pulling. Do you guys have to do much pushing and pulling of large objects? No, you have to handle any laundry carts or anything, or carts on wheels. So they may not be like super big, but they might be substantial with the supplies and equipment. So when you're thinking about pushing, okay, fantastic, I'll use this one. I'm going to essentially stagger my feet a little bit so that I can use my legs to shift my weight. I'm going to keep my abdominal muscles tight. My spine's still going to be straight like we practiced earlier. And I'm going to bring myself to the level so I can push. So I'm using my legs to do that push as opposed to pushing with my arms and my back. Okay. Notice I picked a lighter cart because I don't want to hurt myself. Okay. And then pulling, you're bringing your legs back, so you're pulling with your legs. All right. So let's talk a little bit about mobility, stretching, and physical activity. Who has a physical activity routine that you already do? Maybe walking, or jogging, or lifting weights, or cycling, or swimming. Yes? You lift weights? Fantastic. Yeah? Some weights. Cycling? All right. Very good. Weightlifting dogs, that actually matters because they can be heavy. So as you are thinking about how you would like to manage kind of the work-life balance as you're entering the field, think about incorporating some physical activity into your daily life, because when we think about what helps us kind of prevent the development of chronic health conditions like high blood pressure or development of diabetes, 10 minutes, okay, we'll make it. When we think about kind of managing those chronic health conditions and decreasing our likelihood of getting them, one of the best things you can do is be physically active I would say every day, but I'm a PT, but the CDC recommends that you get 150 minutes per week. And so that could be 30 minutes a day for 5 days, right? Of moderate, which is kind of a brisk walk or cycling, moderate activity for aerobic activity for every adult. And so that time doesn't have to happen in 30-minute chunks either. It could happen in as little as 10 minutes. So between clients, I have a 10-minute break. I'm going to go for a quick walk around to get my heart rate up a little bit. Okay, so in addition to the 150 minutes of moderate activity the CDC recommends, they also recommend some weightlifting for 2 to 3 times a week. Hitting the big muscle groups, which would be your leg muscles in your thighs and your hips, and then also your upper body muscles in your back muscles. Okay, if you are in the salon and unable to get out to the gym, there's a couple of things you can do over the course of the day if you start to feel stiff. So would you like to do a few of them? I have a couple. We can try. Yeah? If you would like to participate, feel free to stand up and we'll go through a few of these together. They're over here on the list. So the first one is just an overhead reach with a side bend. So I'm just going to interlace my fingers, bring them up over my head, and then I'm just going to bend to the side. Nice, comfortable, you feel a stretch on the side of your body. And then I'm just going to switch to the other side. Some grimaces, just go to where you feel comfortable. Don't try to push past the point of pain. Okay, from here, I'm just going to drop my hands down behind my head and feel that stretch in the back of my arms and in my shoulders. Okay, so that's your hands behind your head, a tricep stretch. You can put your arms down. You're just going to roll your shoulders backwards. Okay, this can be really good if you've had your arms up, providing service with your hands a little bit. We have the back scratcher. That's where you're going to take one hand overhead and one hand behind your back and try to make your fingers touch. Okay, if you can't do it, that's okay. I'll show you my other side. My other side doesn't work so well. That's all right. I had a left shoulder injury in my teenage years, and it just doesn't go that far. Just kind of work on it, right? It's not supposed to be uncomfortable, just a little stretchy. Your neck half circle. So you're going to look towards one shoulder, and then with care and consideration for your neck, you're going to drop your chin down towards your armpit, roll towards your chest, the other armpit, and back up to your shoulder. And then you would reverse that direction towards the armpit, chest, armpit, and other shoulder, just to stretch out those neck muscles. You have a trunk twist. You're just going to keep your feet steady on the ground and then twist and look over your shoulder. If you feel comfortable here, you can add your arms and twist a little bit further into the thoracic spine, and then you'll switch the other side. Just getting those body parts moving. You've got your heel to buttock. This is just a stretch for the front of the thigh. I'm holding on so I don't fall over while I'm talking and looking at you guys. If you don't feel comfortable, it's all right. Stretch just the front of the leg, and then you would have the opportunity to stretch the other. Okay, and then we have a standing hamstring stretch. So here you're just going to put one foot, the heel on the ground in front, keeping the knee as straight as you can comfortably. Hinge your hips back, only where it's comfortable. See, I'm just seeing some facial reactions. Feel a stretch down the back of your leg there. And then we'll switch. So the other heel will come on the ground forward, knee straight, push the hips back. Okay, so hopefully that helps. That feels a little relaxed. You may feel it in either, because when you pull your toes up, you're also stretching the calf. When your knee is straight and you push your hips back, you also stretch the hamstring. So it could be one or both. Okay? The heel toe rocker. This is one of my favorites. You know, on the airplane, you did the heels up and down. Same thing here. Up on my toes, back on my heels. Toes, heels. So I'm getting a little bit of a stretch and a contraction of those muscles in my legs. And it works on your balance. Balance is also a component of your mobility. Your calf stretch, 1 foot behind, heel on the ground. Shift your weight to that front foot. Feel that stretch in the back of your calf, on the back leg. Okay, it's one of my favorites. Okay, and we'll switch and do that other leg. Little step back, heel on the ground, and shift your weight to the front foot. Are we okay with the knees? Everybody's knee feels okay? All right. And then the last one here, there's a picture on the board. It's the seated or standing cross leg. If you want to sit down to do this one, you may. I'm just going to hold on. I'm going to cross one foot up and essentially stretch my hip out a little bit. Okay. If you're really well, if you do yoga, maybe you can do the tree pose. I'm not that good. No, it's a seated chair. What's the name of that pose? Well, you're very good at it. But these could be some things that you could incorporate kind of within your area or in the break room, perhaps, to help yourself be more mobile over the course of the day. All right, last couple of things. We've talked, as we've gone, about some ergonomic stations, things you can do in your station. Here we have the anti-fatigue mat that you can see here in the picture. Sure. You bet. So there's an anti-fatigue mat. That's what one of the things it may look like. Okay. You notice you guys talked about the chair that can go up and down, right? Your adjustable chair, and then a chair that's also not going to be so tall in the back where you have to maneuver around the back of the chair to get to someone's head. Okay. So these pictures were generated by ChatGPT. So let's take what you know about ergonomics and tell me what's wrong.
Got really high heels on.
Yeah, like look at her shoes. They're kind of bad, right? High-heeled shoes, very pointy-toe shoes. She's hunched over. We'd tell her to raise the chair and to lose the shoes, right? What else? She's also looking down. She needs to bring that chair up. Maybe she needs to sit. You know, she's pretty tall. What about this other one? And don't mind the Edward Scissorhands shears. So sorry about that. ChatGPT is still figuring out how to generate good pictures. What about the other one? What do you notice about that one? Yeah, like the client's head is really bent over. Ask them to sit up. It's okay. They'll be more comfortable, right? If your client's always like this, their haircut or their style would be uneven, and then they're going to be uncomfortable when they're finished. All right. So here's a couple of hopefully better pictures. What do you see about these that you could maybe implement in your own practice as you get started? A choice to sit down to adjust for the height, okay? Sorry? The anti-fatigue mats. They're all wearing hopefully supportive shoes. Yep, they've got the chairs that are adjustable. Perfect. The workstation, things are within reach, right? They're not having to reach up or reach down a whole lot to get to things. Anything else that you guys notice? You guys did a nice job picking out some of those pieces. Excellent. All right. So today we've talked a little bit about some common conditions. We've done a little bit of body mechanics, ergonomics kinds of things. We've done some stretches. Hopefully you've had a chance to have some of your questions answered. If you have any questions about what we've talked about, feel free to bring them up right now. Any questions? Yes. Yes, lifting weights is good, yes.
Yeah, so I like to run, and it's like recommended to take a bit of a break every once in a while to not mess up like your joints. Do you have to do the same thing with like weightlifting?
So the question is, do you ever take a break with weightlifting to not mess up your joints? Or
like whatever to translate, I guess.
Sure. So I think there can be some periodization where you essentially lift a little bit heavier weight to build some muscle, and then you give your body a recovery period. So it takes our muscles anywhere from 24 to 48 hours to recover from a heavy lifting session. And so if you were to be doing like heavy weightlifting for your legs one day, maybe the next day, if you still want to do some weights, you would focus more on your upper body. So you're kind of alternating.
But not like a long period of like a break, right? Not like a month or two or anything like that.
I don't know of any research that would necessarily support taking an extended break unless you have a medical or health condition that would require that. Yeah. Good, thank you. Other questions? No? Everybody's ready to be done? Question? What?
Behind your shoulders.
What about behind your shoulders? Are you having pain right there? When does that? So the question is about pain between the shoulder blades, more on the left side, it looks like. When do you have that pain? So when there's a cold breeze or wind? So days when you're not stretching, do you feel like the muscles are stiff in that area? Are you asking me for like a stretch for that area? Is that? Okay, so the stretch that we did where you're bringing your hand overhead, that could be something that could help with the scapular region. You can also bring your arm across your chest to kind of open that space up. A lot of times when we have pain between the shoulder blades, it's also because we have some weakness in the muscles that help bring our shoulder blades together. That can be addressed at times by squeezing the shoulder blades together themselves, kind of like you're trying to pinch a pencil in between your shoulder blades, holding it for a few seconds and then relaxing, so that you would do several repetitions of that to build some endurance in those muscles. Okay, any other questions? All right, well, thank you guys so much for staying and being a part of this presentation. I appreciate the comments that you guys have had, the suggestions, and, oh, okay. These are Dansko. They're just the lace-up version. So they have a nice arch support to them, a good heel set, and then the forefoot is firm enough where it doesn't collapse under my arches, and then it has a wider toe box. All right, well, thank you so much. I really appreciate you guys being here today.
Thank y'all so much for coming. You're done.